The information in this video will help you to spot signs that someone you are caring for might be at risk of losing weight without meaning to. Remember, it's important to be able to spot signs that someone isn't eating well as early as possible, ideally before they become undernourished. As their carer, you are in a unique position to notice these things early on. Some signs are physical and could be obvious, but there will be others that may be more difficult to spot. If you notice any of these signs, it's very important to record this in the person's care plan and to notify your team leader or manager so that the person gets advice and support they need early on. Also, you can discuss this with the person or their family. Let's start by thinking about some of the physical signs you might be able to notice. Have you noticed that a person you're caring for has clothes that are beginning to look looser? Pay particular attention to waistbands or shirt collars. It could be that they are needing to increase the number of holes on their belt, or that their watch or rings don't fit as well. If you are supporting a person with getting dressed, these types of signs could be more noticeable. Sometimes when a person loses weight, their shoes or slippers can become loose too. This could also increase their risk of falling. There are some other physical signs that you may have noticed. Sometimes you will find that a person has trouble chewing or swallowing. This could be for a number of reasons, such as poor dental hygiene making their mouth sore, or Parkinson's disease, or dementia affecting swallowing. When supporting someone with oral care, it's good practice to ask how their dentures are fitting. Loose-fitting dentures can be uncomfortable and can cause discomfort when eating. You may also notice that a person has a lack of energy, low moods, and seems weaker than normal. These are all signs that they may not be getting good nutrition. Other signs to watch out for could be that they are getting sick often, or that their skin is dry and fragile with wounds that are slow to heal. Not all signs will be physical, and you may need to do some detective work yourself. Check to see if you can find evidence that they have eaten an evening meal, especially if this happens when you are not there. Can you have a look in the bins to see if they have thrown food away, or if they have made a meal? Look in other places to see if there is uneaten food lying around, or even hidden. Sometimes people will try and hide the fact that they don't feel like eating. This is understandable, especially if they don't feel hungry. But we should try and explain how important it is to eat and drink enough throughout the day and the benefits this will have on well-being. If you notice that someone has not been eating their meals, it's a good idea to try and start a conversation to find out how they are feeling. You could start by saying something like, "I've noticed that you didn't manage to eat your breakfast. Are you feeling okay?" Or ask if they need any help or support to make a meal, reporting back any concerns. As people get older, they can often feel like eating less food, and if they lose their appetite, it can very quickly make a difference to their health. Finding out what foods they like and what they fancy can be a good place to start when supporting a person to eat well. If you have concerns for someone, follow your organisation's reporting pathway so that you can get the person the support they need. It may be appropriate within your role to provide some support and information regarding food fortification and how to make every mouthful count. Follow the guidance within your organisation and our food fortification training videos for how to do this.